My name is Dr. David Boynton. I'm a chiropractor specializing in functional medicine. This is my office, so thanks for coming. We're called the Sycamore Integrative Health Center. So what is the integrative part about what we do? Well, we have a lot of multidisciplines here. Myself as a chiropractor, Dr. Luke is a chiropractor. We have massage therapists, neurologist, dietitian, nutritionist. So we offer a lot of services here. That's what makes us different than just a single provider office. We can really tackle most people's health problems from a multitude of different angles. So our massage therapist, Zach, was unable to be here, so we have a brief video of him. Dr. Luke is going to talk about how chiropractic care can help out with ADHD, and I'm going to finish up with talking about how functional medicine, what we do from a diet, nutrition, and lifestyle standpoint, can really help to optimize the brain function of kids that have ADHD and adults that have ADHD as well. So let's go ahead and get started here. So this is our, not mine, but our approach to ADHD and the treatment of that. So what are we going to learn today? I don't want to bore you too much, so we're going to kind of get right in here. So this is our approach to how we can treat successfully ADHD. So you really have to understand the brain of someone who has ADHD because it's literally different than everybody else's brain. My son has pretty bad ADHD, so I can completely relate to you parents out there who have kids that you cannot understand, because I don't know why my son does the things that he does, and he doesn't know why he does the things that he does either. So I'm always in my mind trying to give him a lot of grace, but he just processes the world different than I do. I am very calm and responsible, and I've been that way my entire life. He would be the opposite of that, and he's the opposite of my wife. So we're like, what is he doing? And why is he doing it? And he's like, I don't know. Isn't it awesome? This is great. I'm like, no, it's not. So they literally have different brains, and it's hard for them and more challenging for them to process the world. So we're talking about that. Neurotransmitters, you've probably heard of neurotransmitters before. We're going to talk a little bit about that. That's basically your brain chemistry. It's how this neuron talks to this neuron, and how that's disrupted in people who have ADHD brains. We're going to talk about the functional medicine approach to ADHD, the medical approach to ADHD, and then what can you do from a dietary, lifestyle, nutrition standpoint. So we're going to give you some things you can take home with you that you can even implement. If you haven't had dinner tonight, you can implement in dinner tonight with you and your family. So you're going to leave here with some Bible information. So first, this is Zach. He does a lot of craniosacral therapy. So if you're not familiar with that, it's trying to help balance the cerebral spinal fluid in your brain, which is made and is pumped down. Gravity pulls it down to your sacrum. Your sacrum pumps it back up to the brain. That's your nourishment. That's one of the ways how you get blood flow, neurochemistry to different lobes of your brain. So when your cranial sutures, your skull does move. So if you didn't know that, it does. It moves very little bit. And these cranial sutures can get locked, so you're not optimizing the expression of cerebral spinal fluid throughout the brain, which is made in the corpus callosum, which is the very center of the brain. So he's going to talk a little bit about that here.
Hello, my name is Zachary. I'm a licensed massage therapist here at Sycamore Chiropractic. I'm a practitioner of craniosacral therapy. Craniosacral therapy is a light touch-based technique to help identify restrictions in the cerebral spinal fluid and to normalize the restrictions in tissues and the fascia. Multiple pathways within the brain are operating in harmony to function normally. With ADD and ADHD, some of these are performing at a higher and or lower rate. When the CSF is relieved, these areas of the brain can begin to normalize. It is critical for the CSF fluid to move unrestricted to perform optimally. I start assessing the CSF flow and gauge the fascia tissue. If flow is restricted, I use hand movement with body feedback to restore proper flow. I switch hand positions to get different angles on the cervical spine, checking for and CSF buildup. Then I start checking the sides of the brain and cranial sutures. For this patient, she had a restriction on her left side, so you can see here where I am working on her left hemisphere. When I work on cranial sutures, they slightly raise and shift to encourage proper CSF flow. After all this work, I go back and recheck to see how the body is responding. The final thing that I can check is the flow in the sacral area and the rest of the spine. When you have fluid not moving up and down, it can circle around and build up, causing issues throughout the whole body.
So your sutures, they lock in like this. They don't move easily, but they move like this. So whenever you have head trauma, sometimes certain cranial sutures get locked up and you're not getting that proper extension and flexion of the skull, which moves this way, which helps to pump that down your spinal cord to your sacrum, which is this bone right here in the middle, if you didn't know that. Then this moves to pump it back up and kind of recycle that whole mechanism. So next, Dr. Luce can talk about kind of what chiropractic adjustments can do to help out with ADHD.
All right. So, good afternoon. Thanks for you guys coming. I'm going to look at it in two kind of different models in terms of what we're looking chiropractically. Each ADHD person and kid adult is different, and so you kind of fall into these two spectrums. I want to talk to them as kind of the spinny fidget, kind of has to keep that activity going, keeps their brain going to calm them down, and more the kind of weighted blanket where you kind of need that full stimulation to calm down. So we're going to look at both of those kind of sides, how we approach it differently chiropractically, and then we're going to look at some research studies at the end. So we're going to start with the fidget spinners. These ADHD presentation is, so you have a part of your brain called reticular activity syndrome, which can get really downregulated in ADHD. And so these are the kids that are running around, moving their arms a lot, really trying to get some more activation in this system. So there's a couple ways we like to work on that is with our adjustments, working the joints, working the Golgi tendons to try to increase that through our adjustments instead of them having to try to figure out sensory movement to try to really ramp that up. So does that make sense? That if we can activate it with our adjustments, then they won't have to seek as much outside and try to manage that aspect of trying to really get that RAS to get activated. So we are going to play just kind of a quick little bit of different adjustments we do. And so obviously we're always looking at the spine, making sure we're getting the spine moving, adjusting well, so then you're getting that signal that in. And so especially up in the neck area with kids looking down, adults looking down at desks, those are areas we work a lot. Upper neck area is a lot with looking at the brainstem of where that RAS is really located. And then we do a lot of extremity adjustments in this type of presentation because those are a lot of those little muscles, little tendons. That's where we do a lot of that work to try to just get that activated. So as you can see, this is just me adjusting Dr. Boynton, but a lot of kind of different things that we may do to try to help stimulate that part of that ADHD brain, okay? So here's the second thing. So kind of complete opposite, instead of looking at the little muscles and activating, it's more an overall general. And so those are the kids that need more of that massage, that craniosacral, that overall kind of calming down, more stimulation overall instead of specific little joints and little muscles. And so this is kind of where more overall mechanoreceptors. And so each part of your body has different mechanoreceptors. So these are the kids that respond more to pressure, calming down, holding them, kind of just giving them overall calming presence. And so these are what I call that weighted blanket. So with the adjustment, we're going to go more in a calmer, more centralized adjustment. So I like to use something called Logan Basic. That's where we take the sacrotuberous ligament, which is right down here from your glute over to your tubers over here. And so it's a ligament, you just put pressure on it, and then you work your way up, putting pressure throughout the spine. And so you're overall working just the whole entire spine in a calm, more mechanoreceptor aspect. So depending on each presentation, we may use a combination. Again, no one really presents as full A, full B, so we use the two combinations of working with the different theories of ADHD to really help neurologically with chiropractic care. So, last thing, looking at some research, there's 23 peer-reviewed research studies that covering chiropractic and ADHD, and so a lot of those are kind of case studies looking at different 5-year-old presents with ADHD, this is the treatment they did, this is how it helped, they're doing better, less less therapy. Now, a lot of that is not like peer reviewed. They're all peer reviewed, but none of it's a lot of like case studies of like with controls. And so they did do one control where they had 12 with chiropractic and 12 with medicine, and they found there was a 25% more effective with just the chiropractic versus the medicine. Again, there's still a lot of research to do looking at kind of the comparative of traditional medicine versus chiropractic, but there's a lot of promising research out there looking at how chiropractic, working with the body, working with the brain, really working with the wiring of the body can help with ADHD patients. Any questions with that before we get more into deep dive of functional medicine?
I do. So as far as doing these chiropractic adjustments, you're trying to hit the sensory systems, then correct? So then does this also work for somebody who just has sensory differences in general, or is this specifically like ADHD?
Yeah, so it can apply to multiple different. Obviously today we're covering ADHD, so that's why it's very specific. But yes, definitely, sensory in terms of like lack of sensory, so you're like you have numbness, neurology. I know with my sister, she processes sensory very differently. I adjust her very different than everyone else in my family. So her, if I put a pressure here, she'll feel it for 20 minutes. For my brother, he will forget about it in 2 seconds. So, and you have to adjust each different way. And so, yeah, that's kind of why it goes back to those two phones of like, so depending on, is it hyper? Yeah. So like my sister's really hyper where she overly sensory. Right. So I can't put as much information, that's why you go more of that calmer. Someone who's not getting enough, you go more of that multiple. Does that make sense?
Yeah. So then is it helpful too to have like a diagnosis before getting adjusted, or is that something that, I mean, obviously you guys wouldn't like diagnose somebody with like ADHD or something like that, but is that helpful?
I know for me, I mean,
no, we really get all the information we need during the exam.
Yeah.
And just our physical exam tells us a lot about what's going on with your nervous system that you may not even be aware of.
Okay.
And ADHD is, he'll cover a lot more into it. There's a broader different aspects of it. So like, or like a lot of people present with like fibromyalgia and a lot of those big terms people really hold on to. They present so much differently in each body that it's almost like, I understand that's the diagnosis they give you, but it doesn't really give me like, oh, there's not like a fibromyalgia, there's not an ADHD adjustment. It's more working with the nervous system. So yeah.
Related to her question, can chiropractic impact like hypersensitivity to sound, light, touch?
Yeah, and so it just depends on kind of what specifically is going on. So depending on, and with that is we have to adjust you differently too. So the more hypersensitive you are, the less we can do. We have some patients where we have to start extremity like fingers, toes, ankles. If I do like a C1 adjustment that's super hypersensitive person, it may overstimulate them and put them in,
Yeah, so when people are hypersensitive, we work on the parts of the spine that correspond more with the parasympathetic nervous system than the sympathetic nervous system. So certain parts of the spine help regulate sympathetic, certain parts downregulate sympathetic.
And he'll cover that a little more in like Vegas, he'll cover sympathetic later on. But yeah, so kind of hitting the different areas and understanding what neurologically, what areas affected. So yeah, we can help with it, but you have to understand like what's going on and what your body can handle. So each one gets like a tailored care, if that makes sense.
The ADHD brain is literally different than the average brain. The actual volume and size of the brain is smaller in certain lobes that inhibit sympathetics. Inhibit means to turn down. So the animalistic part of the brain is in the basal ganglion, which is toward the posterior part of the brain. That is your, I want this now, I can't sit still, I'm going to do whatever I can to get what I want. It's the animal part of your brain. It wants to eat and survive. The frontal lobe is your logical thinking part of the brain. The frontal lobe's job is to turn down the back of the brain, and they don't do that very well because this part here in the middle, how the brain, different lobes of the brain connect, is smaller. So their brains are literally different than ours, and you can actually make a change in the volume of the brain up to about 20 years old, which is pretty interesting. And I'll talk about why that's important, that it's more than just, yeah, my kid's hyper. The impact that it has as an adult is way, I don't want to say worse, it's just different. And when I was preparing research for this too, I was like, wow, like that's really bad. We really need to get on this for my son Eli. We got to start being more aggressive at treating him before he's 20 years old, before it's permanent changes. So we can actually help the volume of kids' brains grow by taking away the things that are inflammatory from their diet and stimulating their brains in positive ways to help balance out that part of the nervous system. So this is a PET scan, a SPECT scan of the brain too. So obviously brains aren't this color, but this is what a control or normal brain looks like. You can see a lot of activation in the frontal lobe. This turns off this. The ADHD brain has a lot more animalistic tendencies. I want this now, I can't wait, I'm gonna be rude, I'm gonna cut in line, I'm gonna interrupt you, and they don't know that that's wrong. Because they're so focused on themselves getting what they want, and they don't have the frontal and the prefrontal cortex lobe stimulating and turning off that part of the brain. So they can't help it, kinda. So you gotta give them some grace, but you can't let them be too bad. So I'm always trying to balance that with my son. So these are the areas of brain we're talking about the most. The frontal and prefrontal cortex, which is in the front of your brain. The basal ganglia, which you can see is towards the middle. The limbic system is in the back, and the cerebellum is kind of in the back and in the middle. So these are the kind of the biggest portions of the brain that are impacted the most by ADHD. So now we're going to kind of break it down into what the different parts of the brain do. So frontal lobe is kind of your planning, problem solving, motivation, judgment. You can read all those things. I'm not going to read them to you. So in people with ADHD, this actually develops slower than people their own age of up to 2 to 3 years. Some of the research I read says that my son's 12, for example, so his brain works similar to an 8-year-old's brain. 8 to 9. So when I look at it, I'm like, you know, he does kind of act like other kids that I know, cousins that are younger than him, from a socialistic standpoint, from a, he doesn't like to share very well. He's very selfish. And he's like, Daddy, was that selfish? Because he literally doesn't know if some of the things that he says is selfish. He just doesn't understand that concept because his brain is so immature for his body. He's typical size, but maybe developmentally, brain-wise, he's actually not. I thought that was pretty interesting. So these are all the important things that people who have ADHD brains, they may not do those things very well. Or maybe they do, I don't know, because there's no, you're going to be this way. This is not a set in stone thing. These are just problems that people may have difficulty doing. The limbic system. So the limbic system has to do with different parts of the brain, the hypothalamus, the thalamus, the amygdala, and the hippocampus. So hypothalamus and thalamus help to work with the pituitary gland, which is the master endocrine gland of your body. The amygdala is the small almond-shaped piece you can see, which is in the middle. And this has a lot to do with emotion, and typically anger. And the hippocampus has to do with memory, more long-term memory. So long-term memory is towards the back. Short-term or working memory is more inner frontal lobe. So the function of this is going to be emotions, behavior. You may notice that people with ADHD like to smell things too, which I think is kind of weird. But some kids, when they were little, want to smell everything and put everything in their mouth because they need that sensory input to help calm their brain down a little bit. This also has to do with the fight or flight mechanism. So flight, fight, freeze. That's your sympathetic. That's your running away from a bear. That's your everything is a big deal all the time and I don't know why. So they're kind of stuck in that sympathetic state and their brain doesn't counterbalance between that parasympathetic state very well. There are times where you should be in a sympathetic state. If you're in danger, if you're doing something that you have to have high levels of focus on, driving really fast down the highway, you can't just be relaxing and doing that because that's not safe. But the problem is that these kids are running away from a bear when they're trying to go to sleep at night. These kids are running from a bear when they're supposed to be sitting down in class paying attention. They're stuck in that. So what do they try to do to calm themselves down? They do things that involve the motor system. So they fidget, they stand up, they walk around, they do all kinds of things that they might not even know they're doing. Eli, sit still. I am sitting still. Your arm's moving. No, it's not. He just doesn't even, he's not aware of his proprioception because his cerebellum is not sending adequate signal from his extremity, which is why we adjust people's arms and legs to calm down the sympathetic response to the cerebellum and the basal ganglion. And the amygdala has a lot to do with emotions, fears, memories. So some people who have ADHD might have an abnormal fear of maybe the dark, maybe of things that I know this is not realistic. I know there's nothing bad in the dark. I'm just afraid of the dark. I know I shouldn't be, but that is an overdeveloped center of the brain because it's always on sending signals. So they're hyper aware of some of these things that they know logically is not true, but in their reality it is. So a lot of times I tell people there's the truth and then there's your truth. And sometimes these things are not the same, and they cannot see the truth because they're so stuck in their truth. So how do we get people out of that? We'll talk about that later. Other parts of the brain, the basal ganglia, is responsible for coordination of voluntary movement. So this is your muscle memory. This is how you learn how to do things when you're a child. And sometimes kids with ADHD have a difficult time learning. They might have delayed benchmarks. They might walk a little late, talk a little bit late, have gross motor things and fine motor control things a little bit late because they're not getting adequate signal because they have typically their dopamine pathways don't work very well. Dopamine pathway is the most important pathway of how the different lobes talk to each other. This has lots to do with the game planning and your working memory. And the cerebellum. This is kind of the balance center of your brain. This is your brain's awareness of where you are in space. When some people have ADHD, it's not that there's so much uncoordinated. Some people might be, but like they might have poor 2-point discrimination. You can touch them in 2 points, and they say it's just 1 point. I only feel one thing here. I don't have the fine motor control to do multiple things out here. I can't, walk and chew gum at the same time type things because the inhibition or the turning down of their cerebellum. And one thing that we found, a lot of the functional medicine tests that we do, we look at mucosal membrane barrier breakdown, and a lot of these kids and adults have an issue with casomorphin. Casomorphin is an antibody response from gluten that impacts your cerebellum. So gluten can impact your cerebellum and cause inflammation and cause an immune system response in your brain. So there's actually a medical condition called gluten ataxia. It looks like somebody has Parkinson's disease when they eat gluten. So gluten can crush your brain. We'll talk more about that later. In ADHD kids, dairy is actually the worst thing for ADHD kids and adults. And we can measure that, which is cool, or just avoid it and your brain feels better. The cerebellum is also a part of the body where you get your pleasure response, your vocal speech. So some people who have ADHD, they need to go to speech therapy early in life too, because that, again, speaking is muscle memory. You don't think about that, but you start mimicking your parents when you're little because your baby's going to watch your mouth move. And then if they don't develop that proper muscle memory, they might have lisps as they get older. They typically always need braces. Oftentimes they suck their thumb because they need that stimulation from their constant stimulator, their constant soothing mechanism, their thumb. You have something called synaptic clefts on each side of the neurosynapse. So this is one cell and one cell. They're called glial cells. They use neurotransmitters, which are the yellow dots, to communicate. And the synaptic clefts are what receives that signal from each cell. That's how the brain actually communicates back and forth. When the ADHD brain, those mechanisms are broken down, specifically in certain lobes of the brain, because remember, they have underdeveloped portions of their brain, so that communication from front to back doesn't work as well as what it should. It's not as effective. So this I want this now part of the brain yells louder than I'm going to turn this down part of the brain because of that mechanism. So there are neurotransmitters that are excitatory. They stimulate things. There are parts of the brain that inhibit things, so they calm things down. And modulatory, they kind of help keep harmony, homeostasis, or balance in the brain. So the first type is amino acids. So we get this from eating protein, typically. So GABA is an inhibitory neurotransmitter. It helps to calm you down. Gabapentin is a medication that helps to calm down nerve pain. So some people respond really well to GABA, so supplements that help to stimulate the GABA pathway. Glutamate is a nutrient, is an amino acid that actually helps to make GABA, and it also helps with learning and memory. But too much glutamate causes overexcitation and can actually kill brain cells. That's found in MSG. So you might find that people who have ADHD, MSG is like pouring gasoline on the fire when it comes to their hyperactivity. What is MSG in? Almost everything processed, and it has 84 names. So you don't even know that you're getting MSG oftentimes. So processed foods, food dyes, food coloring is just going to overstimulate. And we're mainly talking about kids too. This also happens to adults as well. Most adults have learned how to control this just because they've lived long enough and they know they shouldn't do these things because it's not socially acceptable. So we're talking mainly about kids that don't understand that those social acceptable things and behaviors to do. So MSG is just fired on their brain. Peptides. So there's peptides called oxytocin, endorphins, and acetylcholine. So those help with memory. That helps with socialization. These help to reduce pain in the body. So sometimes you may have heard the expression of getting a runner's high or your workout. You get all that endorphin rush to your brain because it helps to calm you down because you've used so much of your body to calm your brain down. Those are the kids, those are the fidget spinner kids. That they're trying to stimulate this pathway to calm themselves down and help out with pain. And acetylcholine helps with memory. So your working memory is in the front, the hippocampus is in the back. And muscle movements help with that as well. And you can get these in pharmaceutical doses as well. You can actually inject them to yourself to help stimulate all of these things as well. And monoamines, some of these may be more familiar to some of you guys. So we have epinephrine, which is adrenaline. We need that. That's important. Epinephrine, norepinephrine, histamine, dopamine, and serotonin. So epinephrine, norepinephrine, those are kind of our alert, fight or flight, adrenaline things. We need those things for survival because sometimes we do have to run away from the bear. But the problem is when we get stuck running away from a bear, we can't get out of that. So what we do next? We give them GABA, which helps to calm their brain down, which inhibits all of the running from a bear, and it helps stimulate this part of the frontal lobe to calm all that mechanism down. Histamine, as you know, when you have allergic reactions, you have a histamine response. Interestingly enough, when we treat special needs kids and even adults too, if you notice that you're way more hyper and have more difficulty in the spring and in the fall, it's because your body is having such a histamine response. So that's going to make you more anxious in the fall or the spring. Your behavior might be worse in the fall and the spring. Your grades in school might be worse in the fall and the spring, or the summer or the winter or whenever it is. So if you know yourself or family members that have this, try to make a note in your calendar on your phone when you notice a particular behavior and when it goes away. And sometimes it overlays exactly with the high pollen counts, the high mold counts, those things, because histamine is an excitatory neurotransmitter. Dopamine is your reward center. This color blue stimulates dopamine because blue light stimulates dopamine. That's why Facebook is blue. They did research to figure out what was the most addicting color, and it's Facebook blue, because they don't want you to ever leave Facebook. Mark Zuckerberg is an evil genius. They do other bad things too, but like what a good marketing, because he understands how the brain works a little bit. So when you are on your smartphones, your eyes are being bombarded by blue light, because blue light makes your brain happy because it stimulates dopamine. That's why people are addicted to their phones, which is bad for you. So you should not be on your phone, but that's not realistic for a lot of people, especially kids. They want to be on it 24/7 because their brain likes dopamine because it gets a reward from dopamine. I like this. It's like a drug. I want to do it more. So my glasses have blue light blocking filters in it. If you don't wear black glasses, you can get screen covers for your phones, for your iPads, and for your computer screens that actually block blue light. So you get less of that dopamine hit that you want. So that's something to consider doing because it makes you addicted to things. And serotonin is kind of your happy neurotransmitter, so that's going to help with mood. Too much serotonin can cause anxiety. It's important for sexuality and it's important for appetite. So that's kind of what the neurotransmitters do. Now what they do and then how do they work? these are some things that we found in research, so commonly associated with dysfunctions. So a lot of medications that your doctors might prescribe you or your children are going to be stimulating the dopamine, norepinephrine neurotransmitters. So that's the to give them more quantities of dopamine, and epinephrine is kind of putting them in that fight or flight state, which is addictive. And this is what emerging research tells us, that it also, and then glutamate is also it's a big part of ADHD as well. Likely due to the interaction with dopamine and norepinephrine. Too much glutamine in the diet reduces dopamine function, causing brain discoordination. I put this part in there, glutamate, aka MSG in all forms. So processed foods really impact dopamine, epinephrine, and norepinephrine.
I have a question.
Yep.
So is glutamate and glutamine the same thing?
No, glutamate is a contributing factor or an ingredient to make glutamine. And you need both. But too much glutamate is bad.
And that's where it's done in the MSG.
That's what's in MSG, correct. So you need some, and you get it from protein. You get it from eating animal meat. So it's not bad. It's when it's super concentrated and put into food. That's why snack food's addicting. That's why you can't just eat 2 chips. Because not only do they taste good, they put chemicals in there to make you addicted to buy more. And this is allowed by the FDA because it is. Because they don't think it's important to, because the sicker we are as people, the more drugs we need to buy for ourselves, which makes the medical model work and puts money in the government's pocket. I can talk for a long time about this, but I will not. So, sympathetic versus parasympathetic nervous system. So kind of, where are you? Where do you live? You should live in both in the right circumstances. So people with ADHD are oftentimes stuck in that sympathetic mode. It's hard for them to get out of that. So they do things constantly like move. They need weighted blankets. They need pressure. They need to talk a lot. Ask lots of questions about things they know the answers to, because talking helps to calm them down. So sympathetic nervous system is going to rev you up. It's that fight or flight. It's your heart beats faster when it shouldn't. You're going to breathe shallower. Your pupils are going to get really big when they shouldn't get big. Your GI tract slows down. Now you don't absorb nutrients as well. Now you might have a little bit of constipation. Your hormones, you get too much of a hormone rush through your body, so now you feel anxious and you have way too much energy than what you need. One way to tell if your kids are lying, if their pupils get bigger when they start talking to you, they're lying. Fun fact. So I always know when my kids are lying. Parasympathetic, that's the calming you down. That's just, I'm just gonna chill out and rest. So my heart's gonna become slower. I'm gonna take deeper, fuller breaths, and my breaths will become slower. My pupils are gonna shrink down. The pupils are the black parts in your eyes. My gut's gonna work better. It's going to actually absorb nutrients at a better rate because I have more blood flow going to my GI tract. Your hormones are gonna become more balanced and you're gonna conserve energy. This is where you should be most of the time. Again, times to be stressed out, times to not be stressed out. It's that when you're stuck, if you're stuck in parasympathetic, that's bad in a different way. So you're bear lunch. People who are in sympathetic, get away. So there's a big overlap between dopamine and norepinephrine. So your working memory, that's the things, what am I going to do today? What do I need to do tomorrow? Your past memory is, this is what I did when I was 5 years old. Your behavior, your motivation, and you can see attention is right in the middle. So too much of this is bad, too much of this is bad, which impacts your attention and focus to details. So this is how we have crosstalk from the gut to the brain. Most of you may have heard of the gut-brain connection. I did a talk a couple months about the gut and how the vagus nerve, which is the biggest bidirectional nerve, which means information flows from your gut to your brain, and information flows from your brain to your gut. And they can do it simultaneously, which is kind of cool. So it's like a 2-lane road. Most neurotransmitters are made in the GI tract, stored in the GI tract, and utilized in the brain. So when you have too much poor diet of carbohydrates, proteins, and unhealthy fats, that creates inflammatory processes which impact the brain through the vagus nerve. So A inflamed gut causes a inflamed brain. Now your brain doesn't communicate as well as what it should. That inflammation in your brain is called a cytokine response, which is inflammatory. Now, when you have inflammation in your brain's going to shuttle the cytokines back down here and inflame your gut, and now you get constipated. Now you get butterflies in your stomach. That's this response. So eating too many inflammatory foods, so processed foods, carbohydrates, food dyes, food additives, MSG, dairy, gluten, sugar, corn, all the inflammatory things we'll talk about later, inflames your gut, inflames your brain. Now your brain can't make neurotransmitters to calm down your limbic system in the back. So the I want this now is always on. You might even notice that the ADHD kid, do you want 1 cookie now or 10 cookies tomorrow? They want 1 cookie now. They don't understand tomorrow, because tomorrow in their future, tomorrow is way off in their future. I want this now because I need that dopamine hit right now. They can't wait for things. So your gut has a huge correlation to that. So when the gut is inflamed, now your body can't make these things, these neurotransmitters, to turn off the back of the brain, and then that's just that repeated cycle of how that works. That's the whole feed-forward mechanism of how the gut bacteria, how the brain impacts by the diet, impacts the gut bacteria, which then feeds back up into the brain. So what are some characteristics of the ADHD person? So they're rude and they don't know they're rude. And they don't mean to be rude, but they can't help it. So they're often inattentive. They make careless mistakes because they don't pay attention. They're oftentimes late because they're inconsiderate of others, because they don't know how to interpret other people's emotions. They can't read people's emotions very well. Now this isn't always true, obviously, but these are some typical things. They have a hard time following directions and tasks, difficulty organizing things. They lose things a lot. They're easily distracted. They forget simple things that they shouldn't forget. They ask the same question over and over again. Maybe even a question they know the answer to, they ask it anyways. They talk a lot. They blurt out answers, so they're not the kid patiently raising their hand in the back of the room. They're blurting out the answers. They have difficulty waiting turns. They interrupt other people, difficulty being quiet. They fidget a lot. They leave their seat, excessive running, climbing. They're off the wall oftentimes. Now again, adults realize that I have to sit here and work. I can't just get up and walk around and not do work. They get that. So this is more for kids. And by the way, this is all going to be recorded on Facebook Live and on our website and on YouTube. So don't think you have to write everything down either, because all this information is going to be here for you. But feel free to take notes if you'd like. So what are some early interventions of things that you can do to prevent your kids, theoretically, from having ADHD if you guys do? So it's important that you breastfeed your baby. There's over 500 things in breast milk. There's only about 50 nutrients in formula. So breastfeeding is crucial to proper brain development. And I recommend for at least 6 months. Sometimes you can't. That sucks. You can get donor breast milk, which sounds kind of weird, but it's super important for your baby if you can afford it. It's kind of expensive, but it really is that important. So do that as much as you can. You need to touch your baby in appropriate ways as much as possible to get all those sensory pathways working as you can. You know, they've done horrible research on children who are neglected. They have all kinds of weird developmental delays, all kinds of weird bad things when they don't get attention. So that appropriate touch all over their bodies all the time is super important for brain development. Movement at an early age. Move your kids' bodies in locomotion. Get their legs and pump them like this to get that proper cross-crawl pattern. Take this arm and this leg and do this to get that mechanism working properly in their brains. Get them into these sports. I don't care if they don't want to play sports. Make them play sports. Make them jump rope. Make them move their bodies. Because movement stimulates your brain so much more than anything else, and get them off their stupid devices. Don't be your kid's friend. Be their parent. Make them do things. I don't want to. I'm not asking you to do this. I'm telling you to do this. That's it. There's no making my kids happy. You're not supposed to be your kids' friends. You're supposed to be their parents. So make them do these things. Make them socialize with other people. And having animals is also very helpful for their brain development as well. You'll see later slides, ADHD kids and adults often abuse animals. They don't understand the importance of animals in their world. And limit chemicals as much as you possibly can, especially when, all the time, obviously, but especially when they're little, because these little infants have no ability, they have a poor ability to detoxify themselves. So air pollution, don't use plastic bottles, use glass bottles. Or really thin stainless steel bottles for kids and infants to drink out of. The new thing now is to put fire retardants in everything. Fire retardants outgas benzene, which is a toxic chemical. Probably most all these chairs in here have fire retardant foam. They put that fire retardant stuff in baby clothes, so your babies don't catch on fire. Buy organic clothes. That sounds dumb, but your kids need organic clothes. And I'm like, that's a marketing ploy. And I learn more. I'm like, daggone it, I gotta buy organic clothes for my kids now. It really does make a difference, especially when they're little. When their brain is developing, you need to limit chemical exposure as much as you possibly can. So getting air filters for their rooms, make sure there's no mold in your house. These laminate floors outgas all kinds of toxic things. So hardwood floors are the best. Carpets outgas all kinds of garbage too. Use VOC, low VOC paint if you're going to paint in your house. So there's lots of ways we can help you guys try to eliminate toxins as much as you can. One of the worst things you can do when your kids are little is to get new carpet. Why? Because they're this far from the carpet when they're crawling around the carpet. I'm 6 feet tall from the carpet. They are exposed to so many chemicals from carpet when they're crawling around when they're little. And their body heat creates heat on the carpet, which makes the carpets outgas even more. So if you're gonna get new carpet in your house, wait till your kids are older, or get it way before they're born. It's more important than you can even imagine. So this isn't necessarily about ADHD, but I thought this was very interesting. This is more autism. Glyphosate, everybody know what glyphosate is? Roundup? Glyphosate and autism. It's almost impossible to have this be a coincidence. The more food they introduce that is genetically modified, autism rises at almost the exact same rate. That's not coincidence, people. That's fact. And it's in the United States, because the rest of the world won't even import our crappy GMO food. It's just here.
What are your thoughts as to whether ADHD is congenital, that they're born with it, or that it's triggered after birth by toxins?
I'm going to
and
talk about that.
exposures?
That's a good question. It's both. And we're talking about some of the risk factors for prenatal mothers, which contribute to their kids being ADHD. And autism, is it vaccines and GMO food and sometimes? Sometimes it's they don't have proper neuronal migration. Their brain cells don't go from here to here in the brain. If that happens, nothing that happens in the rest of your life is going to fix it or make it worse. Kids that are typical and then get a vaccine are typical, they get some sort of medical intervention, and now they have autism, it's from that medical intervention. Because what we don't understand, and I don't know that we have the science to even figure this stuff out, is whatever is in you mothers and in your moms and in their moms is going to be in your baby to a certain degree. Because all those toxins, heavy metals, plastics, things that we can't measure yet, cross through the placental barrier and are stuck in your cells. We can't measure intracellular toxicity. We can only measure extracellular toxicity that's in the plasma and the serum. So that's why it's so important that women who are in childbearing years, they detox significantly in different ways to get as much junk out of them, because whatever's in them was in 2 generations of their family, and you want to make sure that doesn't get into your child. So that would be you guys, considering no one else is in that stage of life, I think. And so whenever you want to get pregnant, you need to detox for a good solid 6 months in different ways to make sure your baby's brain is as healthy as possible. Because it's so many things are against them as little kids. When I grew up, I'm 46, when I grew up, there was a couple kids that had ADHD. There was one weird kid that had food allergies. Now it's like half the school, they have whole portions of the cafeteria you can't bring peanuts into. It's because of all this crap and the toxins in our world. Yeah.
Well, I was also going to say, like, as far as glyphosate goes, that there's actually been, I've been hearing a lot about it, that there's glyphosate in vaccines as well, and that
It is.
vaccine, like, there's a lot more vaccines nowadays than there were even when I was younger, and they're just continuing to put this in there.
More and more in there.
Yeah.
Because if we have sick kids, they're going to need medicine their whole life.
Right.
There's glyphosate in ice in Antarctica that's like a mile deep in the. I'm like, really? It's just everywhere. Monsanto's the evil empire, and then Bayer bought Monsanto, so now Bayer is the evil empire. We've known that it's been proven true in science that glyphosate has caused cancer for the longest time. Now it's in all the commercials. This was proved 20 years ago. People have died because they sprayed Roundup and they thought it was fine because they bought it at Home Depot. It's not okay. Toxins are so bad for your nervous system. Your nervous system is your brain. What else impacts ADHD? Milk products. Way more than anything else. This is kids and adults. If you have ADHD, you must eliminate dairy from your diet. All dairy. Goat's milk, cow's milk, everything. And that'll make significant change. And we can actually measure the impacts of dairy on your brain through functional medicine testing. Corn. Why is corn such a bad guy? And why is corn such a bad guy? Because it has a ton of Roundup in it. It has a ton of glyphosate in it. Wheat is also a bad guy. You've probably heard of gluten. Why is gluten so bad for you? Why is gluten in America bad for you, but not in the rest of the world? It's not so much the GMO, it's because it's hybridized. So let's say if we planted wheat in this room, we got, how do you measure wheat? A bushel? I don't know. You get 10 bushels of it. They hybridize it so this same plot of land now produces 100 bushels for the same amount of space. So that means there's 10 times more gluten in that wheat, and our body just does not know what to do with it. That's why people who have severe gluten sensitivity can go to Europe and eat all the wheat they want, because it's not new wheat. It's hybrid. It's because it's the ancestral grain. It's what wheat should have been like. But because we want to make more money on less amount of land, they've genetically modified it so much to produce more. So
But when we see bread in the store that is said it's made from ancient grains,
that's
what's that
marketing.
mean?
That's all marketing. All natural means nothing. Organic sometimes doesn't even mean anything. Ancestral Grains is a good marketing person who named that company.
What about things like einkorn and stuff
You
like
have
that?
to buy einkorn.
Right.
It needs to say einkorn. Einkorn is old or original wheat.
Or fermenting to break down.
And you can ferment your
Like sourdough.
Yeah, like you can ferment it because the active enzymes inside the fermentation process it eats the gluten, it consumes it as food. So, yeah, sourdough is a better option.
What about like the fermentation process for making cheese? Does that then make milk products better?
Yes, it does, because the fermentation process breaks down the casein, the whey, and the lactose. Still inflammatory, still in there, but it's better. So if you're going to have cheese, the harder, the whiter the cheese, the better.
Harder the whiter?
Whiter, because cheese is white, right? It's not orange, it's white. Milk's white. We're the only animal that drinks another animal's milk. Shouldn't do that either. Because cows eat corn. Corn has glyphosate in it, a ton of it. So now we drink milk that has glyphosate in it. We give it to our kids, who crushes their brains. No wonder we have, from one food, your baby, our pediatrician got so mad at us, because we only went once. So my wife made me. You gotta give him milk. I'm like, are you out of your mind? And she looked at me like, are you talking to me? I'm like, how much, I'm like, do you even know how much calcium is in milk? And she's like, no. Like, how are you recommending something? I'm like, do you know how much calcium is in broccoli? And the healthy food we give our kids. She said, no. I'm like, we're not going to give our kid milk. And we don't. And my kids are gigantic. So, milk does not do a body good. Another good marketing play. Cocoa, eggs, paprika. So a lot of these things that you wouldn't think of really impact all of our brains, but the ADHD brain worse. Risk factors for ADHD. These are things that you can control before you get pregnant and after you get pregnant. So prenatal, so low prenatal weights, the low education of the father, childhood, adolescent head trauma, but childhood eating disorders is higher than almost everything else. So this would be the lowest, this would be the highest. What does a childhood eating disorder mean when it comes to this research? Food that is high in processed foods, carbohydrates, trans and unhealthy fats are the biggest contributing factor to the ADHD brain. You can't let your kids eat processed food, especially when they're little, because it destroys the architecture of their brain. And that window is about 18 to 20 years old. After that, your brain is not going to grow anymore. It's going to degenerate. The more of this crap you put in your body, the quicker it degenerates. You need to eat as much of a paleo diet as you can afford. What is paleo? Fruits, vegetables, and meat, which you can get. It's a caveman diet, which you can grow, gather, or kill. Sometimes it's expensive, sometimes it's not. Seeds cost dollars or pennies. If you can grow a garden in your backyard, you can go garden in an apartment on a balcony. You can get a grow light and grow food inside. There's ways. Sometimes it's more challenging for people. But what your kid eats when they're little is crucial. There's food dye in formula. There's MSG in formula. Your kid's screwed. And you don't even know that it's a bad thing. You trust Abbott Foods to make healthy formula. You trust Infamil to make healthy formula. They use the lowest quality ingredients as they possibly can to make the most amount of money. As long as your kid is growing, getting larger in weight and length, your pediatrician's happy. Because that's all they measure.
What's about eggs that is concerning? And if a food allergy test shows that it's not a problem, is it still a problem? As far as food, is there something in eggs?
Whenever you're eating an animal product or a product, animal byproduct like eggs, what did the chicken eat? Chickens are fed corn. Corn's glyphosate. Eggs have glyphosate.
Okay. So if we get them from an actual farm.
Pasture raised, yeah. Chickens eat bugs and grass, healthier for you. Sometimes the albumin in eggs is inflammatory to some people. So yeah, are eggs good for you? Yes. Are eggs bad for you? Yes. So it's what did the chicken eat is really the biggest thing when it has to do with eggs. So childhood eating disorders, if the mothers smoked anything or around secondhand smoke, drinking alcohol, trauma to the mother, or if the mother has a virus, a really bad, not like a cold where you're down for a couple of days, but like a significant virus, all those things impact baby brain development a ton. And now when your baby brain development is a little bit subpar, all of these things have such a bigger impact on their brain because their architecture is already altered. So now, just that little bit of MSG, just that little bit of food dye, just that little bit of all these other things make significant problems when their brain is not developed properly inside mama's tummy.
I was kind of wondering, my child with the ADHD issues had a severe virus when he was like 14 months old that landed him in the hospital for a week.
Yeah.
And I've always wondered, like, is that what
Part of it.
changed him? You know, like, I'm sure it's obviously a lot of
It's a
different
lot of things.
but I've always wondered
Is
if
it part
that's
of it?
what
Absolutely, because
set him apart from my other
that created
kids.
brain inflammation.
Yeah.
And the brain does not heal well. It heals better in kids than it does adults, but it just does not heal well. Why? Because we can't get a lot of nutrients into the brain, and it's hard to get inflammation out of the brain. because our body has the lymphatic system. Our brain has the glymphatic system because the glial cells communicate with each other. The only way to get bad things out of the brain is for movement of the body. Movement is the only thing that gets things out of the brain, because once things cross the blood-brain barrier, they don't really get back out very well. And head trauma, viruses can cause a breach in the blood-brain barrier, so things got through that shouldn't. We can measure that through functional medicine testing. Looking at zonulin and other markers, we can look at lipopolysaccharides and things like that to see what's getting through that shouldn't and what's getting out that shouldn't. SB100 is a protein that's found in your brain. If it's in your blood, that means you have a breach in your blood-brain barrier. If you're zonulin or occludin are high, that means you have a leaky gut. Things are getting out of your gut that shouldn't. ADHD kids have leaky guts, for sure. How much? What does food do to them? You give them a little bit of sugar and they're off the walls, they have a bad leaky gut. You give them sugar and they're just a little bit off the wall, maybe the leaky gut's not as bad, but we can actually get quantitative data from functional medicine testing to know the severity of their problems, because if you don't know the severity of the problems, I'm going to show you what's probably going to happen to them when they get older. What can we do for adolescents? Teenagers want to eat junk food, just bottom line. And it wasn't, junk food was there when I was growing up and many of you, but it's so much worse now. I mean, even looking at Doritos, it was unhealthy back then. It's way worse for you now. Well, they didn't have GMO corn back then, they do now. Yeah, that's what Doritos are made of, GMO corn. But their diet is horrible typically. They eat unhealthy fat, sugar, die. So how do you help that? You got to get your kids in sports. You got to get their bodies to move, because you have to get inflammation out of their brains through the glymphatic system. Socializing with others is so important for the ADHD brain, because they need to understand things that they do, how they affect other people. That's why my son asked me, was that rude? Was that selfish? Because he just doesn't know. And I'm like, how can you not know that in my mind? But he just doesn't know. If your spouse has ADHD, they might be a jerk and they have no clue, because they never learned those social cues and things that they should have. So you got to give people grace. That's why it's so important to fix your brain before they're 20 until it's permanent. So counseling is helpful, but oftentimes kids who have low ADHD, they have shame because they're different. I can't sit still. My son told me one thing and almost made me cry. He's like, Dad, you don't know how hard it is to be me. And I brushed it off, and then I went back and kind of chewed on it, and I'm just like, my little dude's struggling just to like be a normal kid. Why can't you sit still? Why can't you just listen? He can't. He has to use so much more brain power to try to be typical. 8-year-old boys are not designed to sit in a classroom for 8 hours a day and do worksheets and pay attention. They cannot do that. An adult can, because he knows he has to. But kids should not be expected to do that. And I think the educational system is starting to realize that more and more. We have had so many parent-teacher conferences with Eli, and none with my 2 girls at all. But they're like, Eli's disruptive. I'm like, I understand. So they put him in the back of the class. Eli, if you need to get up and walk around to move, because movement really helps to calm him down. He's one of the fidget spinner kids. The pressure, he loves pressure too, so he loves to get adjusted. He loves hugs. He loves to swim in the pool, because that's a lot of stimulation. He doesn't like weighted blankets, but he likes lots of blankets. He said the weighted blanket's too heavy for him, but he'll have like 4 or 5 fleece, like blankets on him to sleep at night, because the pressure is very soothing to him. Because that sensory input down-regulates his fight or flight mechanism. So a lot of times they don't like school because their brain has to work so much harder. They are mean to their friends and don't know that they're being mean to their friends. So these are all things that counseling can help them. It's like, that's how you are. You have to figure out how to live with this. My daughter has dyslexia. I have dyslexia. That's not going to go away. You have to use that to your advantage instead of using it as a weakness. So kids that have ADHD, this is what they do. This is the peer. This is the ADHD kid. They steal, they lie, they destroy property, they're cruel to animals, they're cruel to people, they use a weapon in a fight. So if we don't fix your kids, this is what's likely to happen to them when they're adolescents. No, that's not true of everybody, obviously, but this is what the research tells us. They have such a higher risk of all of these things: getting in fights, having truancy, breaking and entering, setting fires, using a weapon. I mean, bad things that are socially unacceptable that they might not be able to control themselves. As they get older, traffic violations are higher, speeding tickets are higher, drunk driving, license suspensions, driver-caused accidents, way higher, and this is an average of 22 years old, way higher for ADHD people. They want to go as fast as they can, all the time. Adults, so what can you do as an adult if this is where you're at, your brain's stuck, and it's what it is? You have to figure out how to stay organized. Use calendars, make lists, set reminders on your phone, whatever makes the most sense for you. Do that. It's very important. You have to find a motivating job because you need that stimulation. So if you live in a dead end, if you work in a dead end job, you're just going to bounce around from job to job to job because you need that stimulation. And a lot of times these people do better in blue collar jobs because they're more physically active. I'm not ADHD at all, but there's no way I could sit in front of my desk and just bang on a computer right all day long. That would drive me nuts. Having a physical job is probably a better option for them than having more of a sedentary job. You're going to tend to be addicted to things more so than your average person. So you have to know that. You may not be able to drink socially because you can't. You may not be able to do certain things that other people can do because I can't have one beer, I have to have 7. I can't take one hit off of a joint, I have to have the whole thing. You're going to tend to be an all or nothing kind of person. So you have to realize that, accept it, be okay with it, and just know your tendencies to make sure that you're successful in life. Attending a church or some sort of other organization, so giving to other people and doing things for others is very satisfying for people who have ADHD because it helps them to have that satisfaction. That's their dopamine hit. Instead of doing the negative things for dopamine hits, doing positive things, taking care of people, is helpful for them. And it's important that you find an understanding spouse and try not to fall in love with somebody else who has ADHD. Because it's harder. It's just gonna be tougher. Because
We can attest to that.
you're gonna relate in some ways, and some things both of you suck at. So you have to figure out how to make that work with one another. And my wife and I, neither one of us have ADHD, so it's so hard for us to understand Eli, man. I just don't get it, and I'm not going to. So I just have to be okay with how he is and help him to get better and remind him to do things because he just struggles with that. These are all ADHD. These are all ADHD people too, by the way. And they're extroverts probably too. So what happens to adults? They have in substance abuse, incarcerations. They're going to hurt people on purpose. They're going to have a higher suicide rate. They're going to repeat grades, teen pregnancies, they're going to get STDs more, and they're going to get fired more. Like significant, not like a little bit. That's significant. You have to fix your kid's brain before they're 20. This isn't a guaranteed thing, but when I started looking into this, I'm just like, holy crap. That's way worse than I thought. I thought it was kind of hyper. I have some friends that are kind of hyper that have jobs and none of this thing impacts them all, but I'm like, if you don't, like, they have a much higher risk of bad things happening to them, which are typically their fault. So, what do we do? Kind of 2 models that we're going to look at. The functional medicine model. We're talking about dietary modifications, lifestyle, nutrition, and counseling. What does a medical model do? Drugs. What if they don't work? More drugs. What if they don't work? Different drugs. Maybe go to counseling. This is interesting. That's what crystal meth looks like. That's what Adderall looks like. It's one carbon group different. Crystal meth is bad. Adderall is bad. It's an addictive substance. So if you are prescribed Adderall, it's a controlled substance. You have to go see your doctor every 3 months to renew your prescription. You can't just write a prescription indefinitely for a year like you can with thyroid medicine or antidepressants because it's so addicting. And oftentimes, if you're on Adderall or these like methylphenidate, these other drugs, kids, you have to get more and more and more as an adult because your pathways get saturated with a lesser amount until there's more. They also call it the Goldilocks principle. You gotta find just the right amount of meds because too much doesn't work and makes you worse, or not enough makes you worse, and too much makes you worse. So it's finding that middle ground. So that's crazy. One carbon group different. So your brain loves it and wants more. So what can you do? You have to remove food triggers. Gluten and dairy free, you have to. You also have to remove food dyes and additives. When you add food dyes to things, it changes the body's immune system's interpretation of the food. Because you're adding now you're adding a chemical to a protein. That protein's different. So we'll just say, for a simple example, chicken. You put food dye on it, your body doesn't see it as chicken anymore. It's a brand new molecule that is assaultive to the body. It understands chicken, but not food dye chicken. So all these things, your food shouldn't have numbers in them besides the quantity. Red dye number 3 is the worst, which I don't think they use anymore because it makes people crazy. So you have to eliminate these things from the body. And we can do serum and blood testing for that too. You have to remove food coloring. Avoid glycemic spikes. So glycemic spikes are sugar. So your kids or yourselves might be addicted to sugar and you want more sugar. You also might be sensitive to sugar as well and have more hypoglycemia. Hypoglycemia is low blood sugar. So you're going to tend to have more low blood sugar issues. So whenever you have hypoglycemia or you get hangry, your brain was inflamed 30 minutes to an hour ago, you're just now having a symptom of it. So if you get hangry several times a day, your brain's getting inflamed several times a day. So keeping your blood sugar is very important. So not having those carb snacks, so that makes your blood sugar go up. The higher it goes up, the farther it goes down. That's why you gotta have snacks that are high in fat, protein, and fiber to keep your blood sugar going like this, not like this. The number one reason people wake up in the middle of the night and can't go back to sleep again is because they have nocturnal hypoglycemia. Their blood sugar drops in the middle of the night, their brain is pissed off and wants to stay awake. So what do? You eat something before you go to bed that's high in fat, fiber, and protein. What is that? I don't care what it is. Whatever you want to eat that has fat, fiber, and protein. So animal protein, a hard-boiled egg, a third of a protein bar, something 30 minutes before you go to bed, because that'll keep your blood sugar stable all night long and you can stay asleep. And if you do wake up at night, drink a little bit of juice, wash your mouth out, and your brain will say thank you, and it will let you go back to sleep again. So if you tend to have hypoglycemia, how many hours between meals can you feel normal for? You eat a typical breakfast. I was hangry 4 hours later. That means you eat food every 3 hours. And we also have to work on your adrenal glands because your stress tolerance is probably typically poor, which means you don't tolerate stress as well. And that's a whole nother, that's probably a different lecture actually.
So when you are hypoglycemic, your brain is inflamed.
Your brain is inflamed, yes. That's why you have symptoms of hypoglycemia. And if you have poor adrenal gland function, you're going to have a higher likelihood of having hypoglycemia. You have poor adrenal gland function because you have chronic stress, because you have ADHD kids. And that's why you drink. So keeping your blood sugar stable is important. It's very important that you increase your fiber intake from a variety of fiber sources. You can't just have chicken and broccoli every single day. One, because you'll develop sensitivity to it, which will inflame your brain more. But you have to have the biggest diversity because that helps your microbiome. Your microbiome is your GI tract. We go back to remember how the food impacts the microbiome, the GI tract, which makes the neurotransmitters, which makes the brain work better. We had it about 20 slides ago. That whole mechanism is crucial to having a diversity of gut flora that makes your brain work better. So we use things that are high in butyric acid. That helps to heal the tight gap junctions. That helps to heal leaky gut. That helps to heal leaky brain. That helps to heal leaky lung. So having a variety of food. I don't like vegetables. Eat them anyways. Or a scoop of some sort of a greens powder in a drink to get that diversity. If you're not going to eat the food, use a greens powder or a fruits and veggies powder is helpful. And omega-3s are crucial. So eating food high in omega-3s, omega-3s are fatty acids. Typically they're found in fish, which we may know of. If you don't like fish, you take the capsule. If you don't like it, get that from vegetarian sources. And keeping a proper balance of a 2-to-1 ratio of omega-3s to omega-6s is also really important. Most kids who have ADHD and inflammatory conditions as adults have a higher ratio of omega-6 fatty acids, which produces something called arachidonic acid, which is very inflammatory to your skin and to your joints specifically. So having that proper balance is really important. So these are some dietary things you can work on. What are some nutraceutical approaches? So what are supplements that you can take to help? So if you have inhibition of your dopamine pathway, those are helpful. If you're kind of stuck in, if you need more epinephrine and more stimulation, you would want to use those products. Cerebral blood flow. Blood flow is important to your brain. How do you know if you have poor blood flow to your brain? If you have cold hands and cold feet, you have poor blood flow to your brain. If you have erectile dysfunction, you have poor blood flow to your brain. Most likely. Now, is it enough to stay alive? Yes. Is it ideal? No. You probably have low nitric oxide, which helps to shuttle blood throughout your body. If you stand up quickly and get dizzy, you may have poor blood flow to your brain because your adrenal glands can't produce adrenaline to make your heart pump enough blood to get that blood up to your brain quickly. Or you have hypoglycemia or you have adrenal fatigue. Different topics. Short chain fatty acids, that's butyrate, so that fiber is also really important. And the essential fatty acids, EPA and DHA, you can get those from food sources, from plant sources, and from animal sources. EPA and DHA are important to get, especially when you're younger. DHA is super important. It's one of the constituents of omega-3 fatty acids. It's most important in the beginning of your life and at the end of your life. Everywhere else in between, a good mix of EPA and DHA are also important, and most supplements have the combination of both EPA and DHA. Exercise and movement is important. Repetitive movement, like swimming, biking, and running, stimulates dopamine, epinephrine, norepinephrine, increases cerebral blood flow, and BDNF. BDNF is important, brain-derived neurotrophic growth factor. That's how your brain heals. Exercise helps to heal your brain. What kind of exercise? HIIT training exercises. High-intensity interval training is the best exercise for your brain. So it's doing repetitive things because your body gets pleasure during repetitive things. It doesn't have to be hard, just do repetitive things. Integrative movement patterns, so gymnastics, karate, so things that you're doing, not just a throwing exercise, but gymnastics, you're using your whole body. Martial arts, you're using your whole body. Rock climbing tests, these are just some basic examples. Focus coordinating exercises, juggling, dribbling, jumping rope. So during our physical exam, we evaluate the hemispheres of your brain to see if you have deficiencies in your cerebellum and your motor cortex and Broca's area. So we're going to give you exercises to do at home. For example, if you have a weak right-sided motor cortex, we're going to tell you to dribble a basketball with your left hand. We're going to tell you to brush your teeth with your left hand. We're going to tell you as you're brushing your teeth, stand on your left foot. Open your left eye and close your right eye. Why are you doing this? Why? To stimulate the opposite side of your brain. So the right side needs to talk to the left side, the front needs to talk to the back, and the back needs to talk to the front. In the right rhythm, and when your brain doesn't work right, that's hard to do. And the more things you can do simultaneously, you're incorporating more and more parts of your brain at once. So these are some things that are really helpful. So these are some actually games that you can play. So go, no-go games. You may have heard those or not, but basically there's different games you can download on your phone. Basically, if you see the image of a bear, you push the screen. If it's not a bear, you don't push the screen. So what do ADHD kids want to do? They want to push the screen every single time, but they have to train their brain, identify the thing first. Do I push it? So it's go, it's a bear, or it's a duck, no go. It helps them to break that repetitive of more. So fine motor control, dancing. There's different apps, and then integrative games where they're using more of their body. So I don't know if kids play these games anymore, but those are some games that you can play to help out with that ADHD brain, even for adults too. This might be calming for them. So this is just kind of a one page, this is what I need to do. Remove food sensitivities, food dyes, keep their blood sugar stable, bunch of fiber in your gut, and omega-3s. Do you need dopamine support? I don't. So these are the things that we figure out in our exams and through testing. Are you lacking neurotransmitters? I don't know, probably. Especially if you have these symptoms we talked about. What kinds of exercises do you need to do? What kinds of cognitive tasks do you need to do? And it's important you try to interact with other people. So maybe if you have ADHD, finding a physical job where you work around other people is going to be really healthy for your brain. These are some products that we carry in our office that stimulate different neurotransmitters, parts of your brain, blood sugar balance. These are the actual names of the products that we will try to come up with a specialized program for you or your kids or your whole family, depending on what you'll need. So what can you do when you go home? You need to work on stimulating your parasympathetic nervous system to get you out of fight or flight. What does that look like? Giving people hugs. Hugs are not drugs. Exercise, probiotics to get that good gut diversity in the microbiome. Meditation, omega-3s, intermittent fasting. Box breathing, I'll talk about that in a minute. Singing, splashing cold water on your face, finishing your shower with as cold of water as you can tolerate on your face specifically for about 30 seconds to a minute. And gargling. What does gargling, singing, and humming have to do with one another? Stimulating your uvula. That's the punching bag in the back of your throat. The more you can stimulate your uvula, the more you get into parasympathetic. When monks meditate, what do? They hum as low as they possibly can. They don't sing high pitched, they get low to totally relax their body. We've all probably seen the picture of like the monks that were like lit on fire in like Vietnam and crazy stuff, and they're sitting there chilling. I'm like, are you kidding me? They were in such a meditative state, they didn't know that they were on. They weren't wearing fire retardant clothing. That's the problem. When they spontaneously combusted, the clothing would have saved their lives. But they were so relaxed, that's unbelievable. But they were in such that transcendental state of meditation, they were unaware of that. So the more you can kind of work on things and make this fun with your kids. Box breathing is breathing in a cadence of a box. Typically it's anywhere from 3 to 6 seconds. So it's 4 seconds in, 4 seconds out. 4 seconds in, 4 seconds out. So focusing on your breathing helps you get in that calming state. If your mind's racing at night and you can't sleep, just focus on this. And remember, you're breathing from your belly, not from your chest. So it's your belly's going out for 4 seconds, your belly's going in for 4 seconds. That'll help calm your brain down so you can fall asleep. So this is a fun little kind of infographic that I found of just things you can start working on. Make it fun with your kids. Hey, we're gonna hum. Everybody hum. You're all acting like crazy people. We're gonna hum. We're gonna gargle. We're gonna sing to calm your brain down.
Do you think that kids with ADHD, my daughter seems to sing all the time, and I think it's probably
trying to calm her brain down. That's why she's singing. And she probably sings louder than everybody else does too, because she needs all that extra stimulant. Yeah. So what do you do next? So meet with me in an appointment, virtual appointment or in person, fill out paperwork, drink more water, get a bigger diversity of fiber in your diet, try to eat a paleo diet and take some omega-3s. So this doesn't have to be expensive. Eat more fiber, eat more omega-3 foods high in omega-3. Which ones? The ones that you like to eat. Look up the list and eat more of those, and your brain will thank you for it. And that's all I have. Does anybody have any questions?
You were mentioning some tests that you run. What would be the test that you run for more specifically like the neurotransmitters and the like omega-3s and all that stuff?
So we run it's called a neurotransmitter. It's a urinary neurotransmitter test. Now, there's some debate in the functional medicine world, which is probably accurate. You cannot directly measure neurotransmitters in your brain without doing a spinal tap. We're not going to do a spinal tap on you because those things really suck, trust me. But it kind of gives a good idea of what's kind of going on, because different parts of your brain actually have and need different parts of neurotransmitters. So we use lots of questionnaires to figure out what's the right test to run. So everybody gets different testing based on what they need. The best way to measure omega-3s is through a blood test. So we're getting a quantity of omega-3s in the blood. For kids, we typically do urinary neurotransmitters along with questionnaires, along with food sensitivity testing, because that's super important. And then just during our physical exam, we kind of play, and I'm observing what they can do well and what they can't do well. And then we give the parents some kind of take-home exercises to start working on at home, just to stimulate different parts of the brains that aren't working well. Because if this part is inhibited, this part's going to be excited. So if we can simulate the inhibited or the slow down side, it's going to help to give you the break to the stimulated side. So everybody's really different. That's why I didn't put the 30, 40 tests that we run, because I'm like, which one do I need? One of those? Mm-hmm. All of those? I don't know. So we come up with a personalized program for everybody, for everybody's budget as much as we can, for whatever your needs are for you or your kids.
You mentioned about when they have an undeveloped frontal cortex, and that you can develop it more.
You can help to speed up that process.
And is that done through the supplements and the diet and
Supplements
stuff,
and the diet and the exercise and all these things, yeah. So if your brain is not developing properly, inflammation will impact it so much more. So really cleaning up your diet is so crucial. And then doing like brain challenging games. So we're going to play memory games to help develop that part of your brain in your amygdala for that planning. We're going to help
have like zero short-term memory, like nothing.
That's called their working memory, because that's responsible in the frontal lobe. But they can remember everything that you said in the past, because my son came. Dad, you told me this one time. I'm like, I don't even remember that I told you that, but I probably did. But what I tell you to do 3 seconds ago, no idea. No idea. So you work on, so you have to force them to do things they're uncomfortable doing, because their brain doesn't want to do those things, because they don't get the dopamine pleasure from doing it, because that pathway doesn't work, because they either don't have enough dopamine, or the sympathetic side is using it all up, so the parasympathetic can't happen. So you have to make these things as fun as you can, and then just make them do things.
And so I have 3 children that were drug addicted that we adopted, and so they have RAD and ADHD.
That's more challenging.
And so that's why I'm like,
How old are they?
9, 8, and 5.
Okay, so they're still young enough, they can still have a lot of potential for growth.
Because I saw all those things that you put up there. That's why I'm so afraid they're going to be in jail. And I've tried with the diet and stuff, and I just feel like I'm failing.
Diet's only part of it.
Yeah.
You can only do so much with diet, and it's not so much what you give them as what you try to pull up out of their diet. But they obviously have a loving mother, because you're here trying to learn how to help them. So if they were in the same scenario, the same world they grew up in, they would most likely have all of those negative things happen to them. So you get to figure out, and we can help you develop a plan, like brain balance centers are great for this.
Awesome.
It's
really
awesome.
Is good.
It's expensive, but you can do a lot of these things at home. Figure out what hemisphere is weak, and play an ear pad only in that one ear to stimulate that one side of the brain. So lots of things you can do, pulling all the inflammatory things out of the diet, putting all the pro-inflammatory things into the diet, and then giving them, figuring out what their neurotransmitter deficiencies are to help all the parts of the brain work well together.
And do you think the cranial facial?
For some people it's huge, some people not so much.
Okay.
That's what we figured out during our physical exams, kind of what type of adjustments do they need. Is it more the pressure? Is it more the cranial sacral therapy? Is it that I'm going to stimulate as much as I possibly can in your body to calm you down? I don't know. That's what we figure out.
What kind of medical professional is best at diagnosing ADHD?
The parent. Typically a pediatrician. And typically they need stimulants. Like I give if my son's acting crazy, I give him some of my pre-workout that has caffeine in it. It calms him down. What are you doing giving that to him? Like he needs to be calmed down. He needs a stimulant to calm him down. I tell like give your kids some coffee. Like what am I? Give them some coffee and see that, and watch how much it calms them down. How much coffee they need? Start with decaf and you kind of go up a little bit. But coffee is not bad for you. Too much coffee is bad for you. Sometimes having a little kid drink a little bit of coffee helps stimulate blood flow to their brain, helps increase cerebrospinal fluid, does all kinds of beneficial things. But typically your pediatrician is going to be the one to determine that. They'll typically give the parents some questionnaires and the teachers questionnaires, and then they'll figure out do they need to be stimulated or they need stimulatory drugs or inhibitory drugs.
Yeah, our pediatrician had both parents filled out and the teacher.
And the teachers.
The teachers was not at all the parents because she can hide it very well while she's at school. Usually there's flirting and occasional this and that, but because Dad and I filled it out separately and we're 10s on all, they were able to say yes, this is for sure.
Yeah, and Eli is so much better at home and so much worse at school too. So yeah, that's why it's important that the parents and the teachers and caregivers, grandparents, the more information they can get, it really helps. Not me, but the pediatrician and the doctor's training them to kind of know what pathways do we need to drive to help calm their brains down. Because they're just going a million miles an hour and they're not even trying to. That's how their brains work.
I think it's also hard because it looks different in girls versus in boys.
And it looks different in girls than it does in boys. They typically don't have the HD part, it's more of the attention part.
Girls are better at like attending in not crisis situation, but in school that's more of a crisis situation where you have to pay attention. Versus so I performed very well in school. I'm 28 years old and just found out that I have ADHD when I was 28 years old. So this is all very new for me. But also I have not gotten diagnosed.
Like, oh, that's why.
Yes.
All those things.
I'm finding out a lot about myself and finding out that there's really no part of me that is not ADHD. I thought I was just a funny, quirky person. It's all just ADHD.
And you are.
But I mean, so that kind of leads me to my question. I mean, I'm 28 at this point. Is there a benefit to being clinically diagnosed versus not? I mean, for my age, but also for kids, I guess.
No.
Yeah.
Do you want to take drugs?
No, and that's why I haven't
Then no.
yet.
In my opinion, no, it doesn't matter. You don't need to be your diagnosis.
Right.
Some people own I am fibromyalgia. I am like this is just a thing that I have. I have dyslexia. I'm like, who cares? I have to use it for good, not for evil. So
I think that if you're a college student, then if you're diagnosed.
If you have diagnoses in school, you can get additional time for testing and you can get additional help. But at this point in time in your life, no. Know what your strengths are and kind of live in that world of your strengths. If you like these types of things, work in those types of fields. Don't work in the types of fields that you can't stand doing those things. Albert Einstein, he was dyslexic and had ADHD. You're an evil genius too. So they're not bad things. People with these kinds of brains are just kind of geared more towards one way or the other. So don't think that you're screwed or your kids are going to be in bad shape if we don't fix them. Because sometimes you can't fix them. You just have to have them cope with everything and deal with everything. But the more of these skills they can learn when they're younger, the more they can take them into adolescence and adulthood. And then we do all the things to prevent those risk factors genetically so that their kids don't get them as well. So it's not a death sentence, it's a fix them before they're 20, and if you find out when you're 28, how do you manage it and live with it, and what can you do? What makes you more ADD? You pull all the dairy out and you're chiller, you eat more dairy and you ramp up again? I can't have it. What it is. Or maybe you can, I don't know. So we have to figure out. We test or we do trials. Do this and see what happens to you. Do this and see what happens to you.
I think one of the coolest things I'm learning is you talk about genealogy, you brought that up. My grandmother's 84 years old, and I just totally felt like I had an epiphany the other day. I was like, she's ADHD. And she's 84 and still thinks she's 50. And still does think, I mean, it's incredible. I think it's a gift in that sense.
Mhm.
You know, for longevity, like I feel like she's gonna remain sharp for someone. I mean, I don't see it. I don't see her slowing down. She still works.
Yeah,
She's
sure.
top producing sales rep for our company.
Mhm.
Like she just doesn't want to retire, and it's like that's ADHD right
She's
there.
getting dopamine fix from
Yeah,
doing
like-
it. So are you.
If it's any consolation, I was practicing medicine for 10 years before someone suggested that I might have it. And they were just starting to do quantitative EEGs then, and it looked suggestive. Years after that, I went to an expert in Florida who was doing cutting-edge quantitative brainwave studies, and he looked at the thing and showed it to me. He said, I don't know how you made it through medical school. It was literally, all of them were off the top of his whole chart. And I'm sort of semi-retired now, but I'm going to keep learning and doing and, you know, same kind of thing.
Yes, you get
So there's hope for your kids. There's hope for you.
Yeah. You just have to do stuff different than everybody else does.